tell me your name and birthday, please?
Francisca Rangel, September 20th, 1989.
Well, it's nice to meet you. So what made you come in today?
I've been having shortness of breath, terrible headaches, been really tired, some chest pain.
Okay, well, how long have you been having these symptoms?
A couple months.
Oh, really?
Off and on.
Okay. Well, I'm glad you came in today. So I'm going to start by taking your blood pressure.
Okay.
You could just give me your arm, please. Alright, so your blood pressure is pretty high. It's at 150 over 100. Normally we like to see a blood pressure a little bit lower, maybe around 120 over 80. So there are some risk factors for high blood pressure. Those include a family history of high blood pressure, being overweight, lack of physical activity, use of tobacco, a high salt diet, drinking 2 or more alcoholic drinks a day, and stress. These could all be contributing to your high blood pressure. Do any of these apply to you?
Yeah. Want to get a bite? I'm sure to get it supersized. Need extra salt? Take off the cap and pour it on. Yeah, this is how it goes. Nursing school stress out of control. It's Amy and Francisca. We got this, that's for sure. Nurse, look at that pressure. Nurse, look at that pressure. Nurse, look at that pressure. That's high. Nurse, look at that pressure. Nurse, look at that pressure. Nurse, look at that pressure. That's high. When I walk in the club, this is what I see. Double fisting drinks every day of the week. Cigarette in my hand and I ain't afraid to smoke it. Smoke it, smoke it, smoke it. High pressure and I know it. High pressure and I know it. I should hit the gym, rather sit around and watch TV. When I weigh myself, I sadly see how bad I tip the scale. This is how I roll, taking care of myself is out the door.
Okay, Francisca, so the doctor looked over your chart and she'd like to put you on some medication to control your blood pressure.
Really? Is it that big of a deal?
Well, it's best to get your blood pressure under control because it causes a lot of damage to your blood vessels throughout your body, and this puts you at risk for heart attack and stroke.
Oh, I didn't know that. What is she putting me on?
So she prescribed you Lisinopril. It's a small pill that you'll take by mouth every day. It's an ACE inhibitor, so it prevents the conversion of angiotensin 1 to angiotensin 2.
What?
So basically, it blocks the formation and release of chemicals in your body that are causing your blood vessels to narrow. So this is going to decrease your blood pressure.
Oh, okay. That makes sense.
Yeah, so you're going to need to monitor your blood pressure every day. So we'll send you home with an automatic blood pressure cuff. I can just have it right here.
Can you show me how to use it?
Oh, sure. So it's pretty simple. You just put this on your arm. You line up where the artery is, right with your artery right here, inside of your arm. You wrap it around. You press the start button. Beep. And then it gives you these numbers right here. So the top one and the bottom one relate to your blood pressure, and this bottom one is your pulse.
Okay.
So I'm going to send you home with this notebook right here, and I just want you to record in it every day what your blood pressure and your pulse is. Okay, that way we can monitor that.
Looks easy enough. I think I can do it.
Yeah? Okay, well why don't you just why don't you demonstrate to me how you are going to do it at home.
Okay. Line up the artery.
Yeah.
Hit the artery arrow. Wrap it around and push start.
Yeah.
And the first 2 numbers are relating to my blood pressure, while the third one is pulse.
Great. All right. put this aside and make sure that you go home with that. You've got your notebook. If you have any questions about it, all the instructions are right here in the beginning, right in the front of the book. All right. So we're going to start you out on a low dose of lisinopril. We're going to start out with 10 mg, and this may need to increase. So we're going to have to set up another appointment in 2 weeks, and what we're going to do is we're going to look over your notebook, we're going to discuss how you're feeling. So I want you to bring your notebook with you, even if you've forgotten to fill it out some of the days. I just want you to bring it anyways, so that we can review that. And even if you start to feel a lot better, like your headaches and your shortness of breath go away, I still want you to come to that appointment, all right?
Okay.
So if you forget a dose of lisinopril, take it as soon as you remember, but don't ever take 2 pills at once, okay?
Okay.
All right. So lisinopril has a few side effects that you're going to need to know about. It can make you feel dizzy if you stand up too fast. So when you get out of bed or if you're watching TV, try not to get up too fast, sit up, wait a minute or so, and then stand up.
Okay.
It's going to make you feel a little faint. Don't increase your intake of foods high in potassium like bananas and leafy greens. And don't use a salt substitute like Mrs. Dash because it's high in potassium and we don't want to increase your potassium levels.
Okay.
All right, and try to avoid alcohol because it can increase the effects of lisinopril.
Okay.
All right, and then if you have any nausea or vomiting, if you have extreme fatigue or you start having muscle cramping, give us a call as soon as possible.
Okay.
All right, so lisinopril is going to help control your blood pressure, but it isn't going to cure it. So making some small changes in your daily life are going to also help lower your blood pressure.
Like what kind of changes?
Like increasing your physical activity or decreasing high intake food with lots of fat and salt.
But I hate running.
Oh, well, I'm not saying you have to go run a marathon. I'm just saying walk around the block once or twice every day and eat fewer foods high in fat, increase your intake of fruits and vegetables.
Okay. I think I can give that a try.
All right, yeah, just try it with some small changes. So here's your notebook. Here's your blood pressure cuff.
Okay.
And I have some handouts for you right here to also take home with you. It just goes over any questions you might have about the medication and also some foods that you're going to want to avoid.
Okay.
All right? So I'm going to see you back in 2 weeks and we'll see how you're feeling.
Okay. Thank you.
You're welcome. Hi, Francisca.
Hi.
Oh, good. You brought your notebook. Can I take a look at it? All right. Oh, these numbers look really great. I'm going to have the doctor take a look at it, but he probably won't want to increase your dosage. So how have you been feeling?
I'm feeling great. No more headaches, no more shortness of breath, and I've been making lots of changes in my life.
Really? Like what? All right, Francisca. Well, the doctor looked over your notebook and doesn't look like he wants to change your medication, so we'll see you at your next appointment, and good job on all the hard work.
Okay, thank you.
Let us know if anything changes.
Okay, sure will. Thank you.